chapter 15, point 2, second part of chapter 15. We're going to finish this thing up today. Welcome to another edition of Thunderdome. Here we go. Alright. So group and family therapy, it's exactly what you think it is. So group therapy, form of psychotherapy that involves one or more therapists working simultaneously with a small group of clients. I do believe that is a question on your quiz. So they can use any approach: psychodynamic, client-centered, behavioral, cognitive. Again, all those are perspectives that we've already looked at. So group therapy has a number of advantages over individual psychotherapy. So group therapy is very cost-effective because people go in on it as a group rather than relying on a client's self-perceptions about how he or she relate to other people. The therapist can observe her actual interactions with others because maybe, obviously, there might be interpersonal problems between the group, and that's why they're there in the first place. The support and encouragement provided by the other group members may help a person feel less alone and understand that his or her problems are not unique. And I think that's a big thing when it comes to psychological problems. You know, a lot of people think this, like, why is this happening to me? You know, and it's not necessarily the case because so many other people are going through the exact same thing. A lot of times, and you know, specifically with like high school students, a lot of people feel alone in a situation when in reality almost everybody is going through the exact same psychological processes, mental processes, whatever it is.
Well, it kind of depends on the situation.
100%. But I'm talking about, like, if I'm generalizing the high school experience.
Oh.
And a lot of people go through very similar things. Now, with the pandy, it's a little bit different, I would say. But
please never say that word.
come on. I'm starting to say pandy and hand sandy. All right, so the support. Okay, the group members may provide each other with helpful practical advice for solving common problems. Connect's model for successfully overcoming difficulties. Working within a group gives people an opportunity to try out new behaviors in a safe, supportive environment. And then group therapy is typically conducted by a mental health professional. In contrast, self-help groups and support groups are typically conducted by non-professionals. So self-help groups, support groups, we're talking about like alcohol, you know, AA, Narcotics Anonymous, NA, any type of recovery group would be considered a self-help support group type thing, where the person running it is not a mental health professional. They might be experienced in the field of being a mentor to others going through the same situation and stuff like that. But again, you know, groups like that, there's rarely a mental health professional there, but it's all about the fellowship that brings in going through a certain, you know, problem, usually substance abuse. All right, family therapy, form of psychotherapy that is based on the assumption that the family is a system and that it treats the family as a unit. The major goal of family therapy is to alter and improve the ongoing interactions among family members. Family therapy involves many members of the immediate family, including children, adults, may include important members of the extended family, grandparents, in-laws. Family therapy is based on the assumption that the family is a system, an interdependent unit, not just a collection of separate individuals. So it's often used to enhance the effectiveness of individual psychotherapy. For example, patients with schizophrenia are less likely to experience relapses when family members are involved in therapy. Then we move to couples therapy, which could be you know, marriage counseling, right? So such therapy is conducted with any couple in a committed relationship, whether they are married or unmarried, heterosexual or homosexual. Behavioral couples therapy. So this is based on the assumption that couples are satisfied when they experience more reinforcement than punishment in their relationship. There's so many books about this, it's ridiculous. It's like, I remember hearing about a book whenever I first got married, somebody gave it to me, and I never ever read it. But it was like a system of, like, imagine you as a bank, and the other person will withdraw and deposit. Meaning that they'll give you these instances of, okay, look what I did, here you go, this is for you, that'd be a deposit. Coming into my bank would make me feel good. And then there'd be other things that the person would do that would withdraw and take from me and maybe cause resentment or envy or something like that. And this isn't too far away from the truth. I didn't read it because I didn't feel like I needed to in my relationship, but those books are out there, a dime a dozen. You can get them anywhere, anytime. I mean, there's so many relationship books when it comes to marriage and committed relationships. So this behavioral couples therapy focuses on increasing caring behavior and teaches couples how to constructively resolve conflicts and problems. A lot of people, I'm in my mid-30s, so I'm witnessing some of my friends and colleagues and all that kind of stuff. They go through this, and it's interesting to talk to them about it. I'm not a psychologist or anything like that, but I kind of have a good idea about everything. But yeah, they might ask me for advice, and what would I always say? Have you tried that yet? Because it's not the end of the road unless you've tried this, maybe. All right. Evaluating the effectiveness of psychotherapy. Guess what? It is better to go through psychotherapy than it is to not go through psychotherapy. When you're suffering from some sort of interpersonal problem, or this thing where you think you might have a disorder or something like that, it is better to go through it than not. Doesn't that seem obvious? Yeah. The thing is that, again, societally, we've been pushed to handle our own problems, and sometimes we're just not capable of doing that, and this is where this kind of steps in. So I'm not going to go deep into this, but it is more effective than no treatment. Evaluating the effectiveness of psychotherapy continues. So what factors contribute to the effective psychotherapy? Therapeutic relationship. So when psychotherapy is helpful, the therapist-client relationship is characterized by mutual respect, trust, and hope. The therapist's characteristics: helpful therapists have caring attitudes, ability to listen empathetically, and are genuinely committed to their client's welfare. If they, they might not be, they wouldn't be in the field if they did, unless for some reason it was all about money. And let me tell you, it takes a long time to get up and running as a psychotherapist. So it's probably, they're never in it just for the money. Client characteristics: motivated, committed to therapy, actively involved in the process. A successful outcome is much more likely. There's something that I kind of apply everything to, and it is falling in love with the process, not the result. The result happens at the end, it's quick, and then all of a sudden something else comes up and you have another goal. But if you fall in love with the process of whatever it is, it could be like getting good at video games, it could be getting good at sport, it could be anything like that. If you fall in love with the process, then the entire experience becomes, it's the journey, not the destination. It's classic cliche, but it couldn't be more true. If you could actually trick your brain into thinking about that. So, that's huge for the client. And then external circumstances, such as a stable living situation, supportive family members can enhance the effectiveness of therapy. This is absolutely true. So imagine if you didn't have a stable, environment, a supportive environment. So imagine if you were homeless. and you sought out mental health and you went maybe to a free clinic or something like that, and you got some great advice, you got some good things to work on with behavioral therapy possibly or something like that, but you don't have anywhere to go. You go back to the streets after this, and the environment, one, isn't supportive, two, probably has the things that are driving you to be a little bit more mentally unstable readily available for you. So yeah, you know, the external circumstances do matter. Eclecticism, pragmatic and integrated use of techniques from different psychotherapies. I hope does everybody know what the word eclectic means? I hope so. If so, you won't miss this question on the AP exam. It just means kind of like a jack of all trades, you know, able to be good at different perspectives and techniques. To be eclectic. It's like I'm trying to think of an eclectic artist that can play more than one instrument and do it well. I bet you Alicia Keys is eclectic.
Who?
You know, Wyclef Jean. That's more my speed. And then talking about your parents, it'd be like Steve Winwood. He's eclectic. If you know who he is.
I know.
Bring me a higher love. Oh. He can play anything. All right. Ooh, new therapies. New therapies. It's like.
Sounds like you might want to go to speech therapy.
Yeah, that's right. That's like me saying, I'm trying to say Jeremy or something like that too. I don't know why. I hung out with my friend named Jeremy this weekend. Maybe that's what's going on. Okay. Eye movement desensitization reprocessing. This sounds interesting, right? EMDR. So therapy technique in which the client holds a vivid mental image of a troubling event or situation while rapidly moving his or her eyes back and forth in response to the therapist's waving finger, or while the therapist administers some other form of bilateral stimulation, aka tones in different ears. So such as sounding tones in alternate ears. This is weird. You just become desensitized because you're involved in a task that doesn't necessarily mean much, right? A distracting task. If you're focused on the task while holding the vivid image in your mind, it would desensitize the effect that it has on you because, again, of the counter distraction situation going on. Exposure therapy, behavioral therapy for phobias, panic disorder, post-traumatic stress disorder, or any related anxiety disorders in which the person is repeatedly exposed to the disturbing object or situation under controlled conditions. If I was able to, again, show you that documentary about OCD, you would see that this woman named Trisha is extremely, she's a germaphobe. She's really scared that she's going to get AIDS. And part of our behavioral therapy is to stand in an AIDS clinic and not get AIDS. And the longer she's there, the better she feels. All right, biomedical therapy. So let's talk about some drugs, prescription drugs. So biomedical therapies are medical treatments for the symptoms of psychological disorders and include medication and electroconvulsive therapy. So psychotropic medications alter mental functions, alleviate psychological symptoms, and are used to treat psychological or mental disorders. So this is the most common type of biomedical therapy. Although often used alone, psychotropic medications are usually, somehow are combined with psychotherapy, behavioral therapy, cognitive therapy, something like that. Antipsychotic medications, so prescription drugs that are used to reduce psychotic symptoms, frequently used in the treatment of schizophrenia, also called neuroleptics. So we have some examples on the right side here. And if you can see, the beginning of widespread use of psychotic medications began somewhere in the mid-50s. And the introduction of those medications have, you can see, number of patients in mental hospitals. So as soon as the 1950s happened, boom, antipsychotics, and then the craziest trend downward through this process of people not being admitted into mental hospitals. Atypical antipsychotics. So this is us kind of like moving on from the original antipsychotic medications. So these are newer antipsychotic medications that, in contrast to the early antipsychotic drugs, block dopamine receptors in the brain regions associated with psychotic symptoms, rather than more globally throughout the brain, resulting in fewer side effects. And we'll talk about that here soon with one major side effect. So drawbacks of antipsychotic medications. Atypicals don't do this as bad as typicals. Remember, atypicals are the newer ones. So psychotic symptoms often return if a person stops taking the medication. Antipsychotic medications were not very effective in eliminating the negative symptoms of schizophrenia. Remember, negative symptoms are taking away, right? Not adding, but taking away. So social withdrawal, apathy, lack of emotional expressiveness, also known as flat effect. So the antipsychotics often produce unwanted side effects: dry mouth, weight gain, constipation, sleepiness, poor concentration. The fact that early antipsychotics altered brain levels of dopamine turned out to be a double-edged sword. So dopamine pathways in the brain are involved in not only psychotic symptoms, but also in normal motor movements. We've already covered this. Okay, excessive dopamine in the brain, there's a possibility you have schizophrenia. Really low amounts of dopamine in the brain, there's a possibility you have Parkinson's. We know what happens. What is the major thing with Parkinson's? Tremors, shaking, constant tremors. Okay? So the long-term use of antipsychotic medications causes a small percentage of people to develop a potentially irreversible motor disorder called tardive dyskinesia. So it is characterized by severe uncontrollable facial tics and grimaces, chewing movements, and other involuntary movements of the lips, jaw, and tongue. We will watch a video at the end of this about this. So we have this thing called the revolving door. So it's a pattern of hospitalization, discharge, and then rehospitalization. It's the same thing as the prison system. But this is for mental health patients. So schizophrenic patients, once stabilized by antipsychotic medications, were released from hospitals into the community. But because of the medication's unpleasant side effects, inadequate medical follow-up, or both, many patients eventually stop taking the medication, and then, boom, psychotic symptoms return, and then they're back in the mental hospital. Revolving door. Anti-anxiety medications. Prescription drugs that are used to alleviate the symptoms of anxiety. Best known anti-anxiety drugs, benzodiazepines, Valium and Xanax. These anti-anxiety medications calm jittery feelings, relax the muscles, promote sleep. They used to go by the name of tranquilizers because of this effect. Again, I've had experience one time with this, and it's because I had LASIK eye surgery. They prescribed me Valium, and I took 3 pills. I have no idea what the milligrams are or what the dosage was, but they said that they wanted me to take it when I woke up, an hour before the procedure, and then when I got there, they were like, you know what, take 1 more. And I took 1 more. And I didn't care. Again, anxiety was so low in me that I didn't care that I smelled my own eye burning. Okay? So guess what? They work. They take effect rapidly, usually within an hour or so. In general, the benzodiazepines produce their effects by increasing the levels of GABA. Remember, if you have increased levels of GABA, then your anxiety is low. If you have low levels of GABA, your anxiety is high. So this is a neurotransmitter that inhibits the transmission of nerve impulses in the brain and slows brain activity down. Benzodiazepines have several potential dangerous side effects. Reduced coordination, alertness, and reaction time. Their effects can be intensified when they're combined with alcohol. And then they can be physically addictive if taken in large quantities over a long period of time. You know, people who have died of benzodiazepines would be Jimi Hendrix, Judy Garland, Marilyn Monroe, all overdosed on those. Then we have Buzzpar. So not a benzodiazepine, and it does not affect the neurotransmitter GABA, but it is an anti-anxiety drug, so it has less side effects. Exactly how Buzzpar works is unclear, but is believed to affect the brain dopamine and serotonin levels. So rewarding sensations and mood. It must be taken for 2 to 3 weeks before anxiety is reduced. So what happens here, it's almost just like a supplement. You know, you can't take something like, you know, a supplement and feel the effects immediately. You have to take it consistently for a couple of weeks, and then you start feeling these changes in your body. And I'm talking about like people who work out a lot. So, you know, you would take a supplement for a couple of weeks, and you're like, okay, now I'm starting to feel this a little bit, you know, this change in my body. This is what we're talking about with Buzzpar. It's going to have to be taken for a while for it to get into your system, stay in your system, and your system to make the appropriate changes. And then, as long as you are consistent in taking it, you're probably going to continue to feel not as anxious. Lithium, we've already talked about. So a naturally occurring substance that is used in the treatment of bipolar disorder, counteracts both manic and depressive symptoms in bipolar disorder. Its effectiveness in treating bipolar disorder has been well established since the 1960s. So can prevent acute manic episodes in the course of a week or two. Once an acute manic episode is under control, the long-term use of lithium can help prevent relapses into either mania or depression. It has side effects. If the lithium level is too low, manic symptoms persist. If it's too high, poisoning may occur. Vomiting, muscle weakness, reduction of muscle coordination. The patient's lithium blood level must be carefully monitored, because if it gets too high, you know, your body doesn't like toxic elements in it, right? Toxicity levels go up, and then stuff like sepsis happens, and your blood pretty much just becomes toxic, and it's hard to overcome that. So lithium affects levels of excitatory neurotransmitter called glutamate, which is found in many areas of the brain. Apparently, lithium stabilizes the availability of glutamate with a narrow normal range, preventing both abnormal highs and abnormal lows. Depakote is what people get prescribed after they notice that lithium is having some toxic effect on them. So Depakote can also treat people with bipolar disorder, but it has a couple side effects as well. Antidepressant medications, these are pretty popular, especially